With the recent school shooting at an elementary school in Nashville, Tennessee, parents all across the country are having to have difficult conversations once again with their kids about gun violence. So this morning I'm joined by Dr. David Crump with the Spokane Public Schools. He's the Director of Mental Health Services this morning to talk about how to cope with shootings like this. David, so good to see you as always. This is a really difficult topic, and you know, in the day and age of social media and how fast people are getting information, our students and kids are being exposed to this, whether they are directly impacted by this in Nashville, Tennessee, or if they just see it on the news like they might be this morning. So tell us a little bit about what parents should do in a situation like this.
You know, really, it's they need to start the conversation.
Yeah.
Don't wait for the students or the youth or children to make that conversation start, because sometimes our kids don't have the words.
Sure.
They don't understand the feelings. Sometimes we have to help give them the words, but to start the conversation. And I think it's really critical that we kind of look at and say, you know what, let's listen to the message, not just the words. Because kind of developmental ages, we don't know. Some kids, they can't make sense of that. And so we have to kind of start that and help them be able to do that.
And you've been with the school district in this capacity for more than 20 years, you were telling me.
Yes.
School shootings have become more frequent. That is backed up by data. What have you seen over the years? Are students more anxious now because of things like this? Are they worried, afraid? What are you seeing?
I see a lot greater focus on establishing a relationship with students by the staff and administration, because it's that connection that really makes it safe. Because a lot of times students really need to know that, hey, there are caregivers, there are leaders, there are people that are trying to strive to make the environment safe. We know within the media that at times, if you're not careful, you can get overexposed.
Sure.
And need to kind of help make sense of that.
Sure.
Students are aware. I mean, they're really intelligent, so they're aware, but they also need to understand, wow, we do safety drills, fire drills. Right. We do relationships to help them be able to solve and to kind of cope with that.
Absolutely. Okay, so you said start the conversation. Parents watching at home or family members, start the conversation, but then what does that look like? How do you have this conversation if you as a parent have never been through something like this? What do you say?
That's a great question, and the fact that what I would tell you first is for the parents to kind of get and understand their own reaction, you know, because it's impacting them, to kind of get a check-in on where they're at, what their feelings are. And then talk to the students and just say, how are you? What are you thinking about this situation? You've heard about this. Because if you avoid it and are afraid of it, no, then they react to that, and then they have to go to others and they have to deal with that. So you bring it forward and say, tell me about this. What's going on? What are you thinking? And then answer their question directly. Don't overshare.
Sure.
But give them the answer to their questions, not what you want to share with them,
right,
but what they're asking. And that's critical.
Yeah, that's good advice. Dr. Crump, thank you so much. Yeah.